After my first pregnancy, I felt horrible postpartum. And after my third daughter was born is when I had some labs checked. And I was like, oh my God, I have prediabetes. And so this is a big deal. I just felt almost like a fraud because I had a medical degree. I was a board certified physician. And I'm like, oh my God, I'm a statistic.
Oh my God.
We have a client who she's postmenopausal. She was dealing with some insulin resistance, couldn't tolerate hormone therapy. Her assessed bio-age on our machines when she first came in was like 77, and she was in her 60s. My husband came home last night and he was like, hey, that client, he goes, guess what her bio-age is now? I was like, and he says like 37.
Oh, wow. Dr. Jaime, welcome to the show.
Hello, Ryan. It's so good to be here.
Thank you so much for coming on. We're super excited. You are a wealth of knowledge. We can go a million different directions. Titan games, hard to kill, menstrual cycle. I mean, we could talk. We're going to talk about it all. So we have to hit all these different areas.
I love it. We won't have enough time, but we're going to hit the ones that are important for sure.
I love it. So first thing first, talk to me about this ATTS, like always take the stairs. What is that about?
So ATTS, always take the stairs, was literally a social media accident. I work at a hospital, and when you come in, you park in this parking garage where the physicians park, and there's an elevator. That's the first thing when you come in the door, but you have to take this separate door, and then there's a staircase. And for me, it's about like 8 flights of stairs to go up to labor and delivery. And then once you're on labor and delivery, you have another choice. There's an elevator that goes to postpartum and the NICU. So I go to the hospital multiple days per week, and it just seems like a really easy time for me to jump on stories, with people. Hey, good morning. Because I think, that's why people love social media, right? The voyeurism, but I can't do that in the hospital. I can't do that when there's patients and things like that. So the stairwell just became kind of this natural thing where every time I was going up the stairwell, I just said like, hey, everybody, always take the stairs. And then I started putting hashtag ATTS. And then it just kind of took off. Like people would post their stories and they say like, I'm taking the stairs because of Dr. Fit and Fabulous. I have seen and met so many people that have told me, you will not imagine, like, they're like, I'm standing there, I'm staring at the elevator button, and they're like, I turned to the stairs. And so it's just kind of become this thing. And there's definitely evidence behind it, right? Just moving our bodies. Like if you work in a place where you have the option, like just taking the stairs every day is like just that added neat activity, non-exercise, activity. And there is a study too that looked at hospital workers, and it was like, it adds like a year onto your life or something like that. So it's just an easy way to get that blood pumping, burn a few calories, take the stairs, plus you thoroughly embarrass everybody that's standing there waiting for the elevator when you get to the top and you're like way down the hallway before they even got off. So ATTS, you guys, and tag me in your stories. I love it. I don't know how it became like a thing, but it is.
It is. And like literally every time I see like a staircase, I feel like Jamie's watching me and I'm like, I cannot take the escalator. I have to take the stairs. And it's just like, people are like, are you kidding me? Like I sometimes I'll have like 2 things of luggage. I'm like, I'm doing it. I'm taking the stairs just because,
My favorite time is when there's a really crowded escalator, like at the airport, and my husband and I will like have a race up the stairs, and I'm sure people are just like rolling their eyes, but it's just like, why not? Like, especially sometimes you're in an airport, you have nothing better to do than not take the moving walkway, not take the escalator. But I get it. Sometimes you guys, I have a floor limit too. Like if I'm on the 27th floor of a hotel, okay, I'll take the elevator occasionally, but just think about it.
I love it. It's just a constant reminder. I love it. I want to pivot and talk about the Titan games, because I think most people are like, she's done everything, right? She delivers babies, but then she was like hanging out with The Rock on Titan games. What was that experience like? Like when you first went on, what was that whole experience like?
It was really surreal because to take you back like the year prior to Titan Games, I had really only been back in the gym for about 2 years. I was like you guys can see this trophy back here. I was like a 2-time lifter of the year in college, but I left college and I was like, I'm never lifting another weight again. I cannot wait for my quadriceps to shrink. Like I wanted to be a woman. Like that's what society said. Like, be a smart woman, wear your white coat, So I was like so far removed from being an athlete. And I applied for Titan Games. Holy crap, like very surreal, even getting asked to come to the combine and try out, and then getting really humbled at the combine, showing up. There's like 25, 26-year-olds. Here I am, like nearing 40. I haven't competed in anything in 15 years, but I got selected for the show. And, the premise of the show is like real everyday heroes. I mean, I get it, right? She's a doctor, she's a mom, great story for TV. But you show up and you're like, okay, like now it's time to compete. Like I didn't come just like now I want to win. Um, but it's also a TV show. So it was just so interesting to see the behind the scenes of like the TV producers don't really quite understand. Like you can't just do an interview and then jump right into like scaling a fence. Like people were getting injured left and right. There was an ER doctor or a sports medicine doctor, Dr. Caleb Redden on the show. And at one point he was like, talking to the producers, he's like, you guys, this is out of control because we were in a closed sound studio in Atlanta. So The Rock lives in Atlanta and he films a lot of his things. He was actually filming Red Notice in the sound studio next door to where Titan Games was filming. So he would kind of go between. But they were doing these pyrotechnics, like, when the gate falls, smoke goes off. But we're in a closed sound studio. So when we got to the top of Mount Olympus, I mean, people were getting like to high CO2. They're like hyperventilating. They're getting tired. It was wild. Like I have pictures of people's injuries. Like it was what you see on TV is such like a tiny version of what happened. Like some of these battles went on for 20 to 30 minutes and you see like a 5-minute edited version for NBC. So it was a great, great experience. I still am in contact with a lot of people that competed on the show. We've become lifelong friends. The Rock is just like you guys think he is. He's like super nice. I think he's shorter than the internet lists him, but his biceps are gigantic. Um, and I only saw him, get testy a few times, like on the set, but he's really nice. And I think, he's successful in so many different businesses. And I don't think that you can be successful like that without being a real human that understands how to interact and communicate well. And, clearly he has a standard by which he lives his life and he trains. I'm sure he takes the stairs. So he's just a really nice guy. And it was such a cool opportunity for me to step out of my real everyday world of being a mom of 3 and a doctor and getting back on a field again, competing. It was so much fun.
That's amazing. And what does your training look like now?
Well, I was kind of panicking when I got selected for the show because I was lifting, but I had watched season 1 and I was watching what they're doing. I'm like, oh my God, they're like pulling 200-pound balls. They're, climbing things. So I started doing like more pull-ups, I started training a little bit differently for the show, just not knowing because you have no clue what you're walking into. But since that time, my workout schedule has really shifted. It's very, very weight based. So I do weightlifting 4 days per week. And then a couple days per week, I do a little bit of high intensity, like a little bit of sprinting, but I really don't do any cardio. When I was trying to lose my baby weight, I was signing up for half marathons. I was on the elliptical, the treadmill. That's just what I thought you had to do is just like, move more, move more. And I would just waste my time essentially, for hours at a time doing cardio. The only time I've done cardio on purpose in the last couple of years was preparing for my bodybuilding show because I, was just trying to create the caloric deficit that was required. But it's now very weight training focused. And for women, I think they're really intimidated by weights. But for most women, what they're really trying to achieve with body composition, they got to focus on building muscle and not on losing fat. We're so fat focused. We're so fat focused. We're so, as women, just tied to that number on the scale, tied to the size of our jeans that we wear. And what's happened for me is, by focusing on building muscle, my pre-diabetes is gone. My hypothyroidism is gone. My confidence is at an all-time high. My energy is back. I'm just a better human. I can be a better doctor. I'm more resilient to stress when I have to get up in the middle of the night and deliver babies. I got 3 kids. I'm running in all directions. People ask me all the time. They're like, How do you live like that?" And really, honestly, it's because I take care of my body. I eat a certain way, I train a certain way, I get to bed on time, and I do those things so that I can live like this because I love life. Like, I love my life. It's crazy. It's not for everybody, but it's mine and
That's
it's fun.
amazing.
Yeah.
It's amazing. And you talk about how you've overcome pre-diabetes, and people look at you now and they're like, here's this athletic woman who's doing a million different things, running around. How did you overcome that? Like, and how did you even diagnose that early on? Like, oh, wow, this is a problem. I need to kind of address this.
Yeah. So I had my first pregnancy. Well, I had trouble getting pregnant with my first daughter, first of all. I'd been on birth control for a number of years. I came off of it and I wasn't having a normal menstrual cycle. So my doctor was like, I think you have PCOS. Wanted to put me on metformin, which is the insulin, glucose sensitizing medicine. Talked about putting me on Clomid, which is a medicine that helps you ovulate and get pregnant. And I went on a super calorie restricted diet. Literally, you guys, it was like cottage cheese and lettuce, took the metformin, and I ovulated the next month and got pregnant. Um, Not what I recommend. But I'm a
Yeah.
doctor, learn from, your mistakes. You're only human. But I got pregnant, and during my first pregnancy, I failed my glucose test. So we do a diabetes test in pregnancy. I failed it. I come from, on my dad's side, like a long family history of normal BMI diabetics. Like my dad was a professional athlete. Like nobody is like obese, but they all have diabetes. And so after my first pregnancy, I felt horrible postpartum, which I just thought was normal. Got labs checked and found out I had hypothyroidism, probably related to my insulin resistance, but I didn't put those puzzle pieces together at the time. And then fast forward, I had 2 more pregnancies, failed my glucose testing again. And after my third daughter was born, is when I had some labs checked. My A1C was elevated, and I was like, oh my God, I have prediabetes. And I just felt almost like a fraud because I have a degree in nutrition and exercise science. I had a medical degree. I was a board certified physician. And I'm like, oh my God, I'm a statistic. Like, right? Like the things that are most common to kill people and make your life miserable. Like, here I am. And I'm telling people all day, like, how to fix these things. Really? Do I know the tools? And so I just started to question a lot of what I, had learned through nutrition and medical school. So I went back and did an integrative medicine fellowship, really started to change my own life, started with diet. It kind of started with like Whole30 and then paleo. And then I was doing a ketogenic diet. I was experimenting with exogenous ketones. Then it kind of shifted to more carnivore. And like now it's a very like low carb, meat based diet. I don't really give it like a title because it kind of changes sometimes from week to week, month to month, whatever my goals are. But my diabetes is long gone. My A1C is like 5.0. I don't take thyroid medicine anymore. I really don't like to take supplements, honestly. I train regularly. I get sleep. I practice ways to be resilient from stress. I really am in tune with who's in my life and who's in my circle. And I've really changed the way I practice medicine big time.
That's amazing. I literally just talked about this, how important it is to encompass all of that, including who's in your circle, and all of that's super, super important. Um, Talk to me a little bit about some of the things that you do. You talked about now, you eat this low carb, meat based diet. Maybe you don't call it carnivore, whatever, but you eat this primarily meat based diet. What does that look like? Like, what does your day look like?
Yeah. Well, one thing that I never focused on was protein. I mean, when I was playing at Nebraska, like they would hand us protein shakes. And of course, I would order steak or chicken or salmon or whatever was at the training table at night. Um, but once I kind of got out on my own and was in medical school, I never focused on protein. It was just about counting calories. And so eating kind of this more meat based diet, it really simplifies it for me because I'm getting healthy fats, I'm getting protein, and protein is one of those macronutrients that is hard to find. Like you can walk through a grocery store, a convenience store, a cafeteria. It's really easy to find carbs and fat. Like they're everywhere. They're in everything. But protein, like you really have to. And when you're at home here in my own kitchen, like I have to think about it. I gotta have the meat thawed out. I gotta have it cooked, prepared. There's just not a lot of simple protein, quick things. So that has really helped a lot. Just having a more meat based diet, it's up to the protein without even thinking about it. Carbohydrates, I really eat like I'll eat some berries. On occasion, I do some sweet potatoes, maybe a little cassava or something like that. But my day to day schedule is I wake up in the morning and I train fasted. Whether you guys think that's a good thing or not, I don't feel like eating. It's 5 a.m. I'm going to the gym. So I do electrolytes on the way to the gym. I do some creatine in my electrolytes to streamline that process. Um, 2 scoops of Relight and creatine. And then I come home and I generally will stay fasted until lunchtime. Just depends kind of like how I'm feeling or kind of what my goals are. If I'm in a phase where I'm really trying to put on a lot of mass, I might have a meal when I get home. Right before this podcast, I had 6 eggs, and that was my fat. That was breaking my fast. So I trained this morning. My first meal today was 6 eggs. And then lunchtime, it'll be some kind of protein, maybe a few veggies or berries or things like that. But once again, the majority of my meal is like 8 ounces of beef or however much protein I need, and then dinner is going to be something similar. We eat a lot of beef. I don't eat a lot of chicken. We do salmon, we do scallops, we do shrimp, and things like that. And then my kids might add, because I'm a family and I know there's somebody listening that has kids. My kids might add a little more fruit. They might have a little rice. Kids Listen, they're like so active. My girls are super active. They can tolerate more carbohydrates than I can. Um, and so they might add, a tortilla to their meal or something along those lines. But we eat as a family and we all eat the same things. I don't make them a special meal like I used to. Like I used to make myself salmon and broccoli and then make them mac and cheese. Like guilty as charged. Um, but that's kind of my daily schedule, and I like eating in that smaller window, so I do some intermittent fasting. It's just convenient for me because I'm in the operating room and delivering babies and chasing around my children, and I don't have time to figure out 6 meals and when I'm gonna eat them, and so I eat generally in like a 6 to 8 hour window, and it works great for me.
Love it. And so you and Sergeant, you guys do the 6 to 8 hour eating window. Do the girls also have an eating window, or do they kind of eat a little bit longer?
Yeah, no, their eating window is definitely bigger than ours, so they're a 3 meal a day. So they eat breakfast, lunch, and dinner, but, their breakfast, they love eggs, they like sausage. We've That was the hard part. Breakfast foods are like carbs, like, right? It's easy to
Oh,
find like waffles and pancakes and cereal. And we've kind of coached them a little bit about eating at school, like trying to find the meals that have more protein. Or getting a second entree so you can get another burger patty if you're still hungry. Because we don't tell them like that's a bad food. For us, like if they want to have an ice cream cone or something, that's great. But we don't sit on the couch after we eat the ice cream cone. We go outside and we use that energy. So we just talk about how food is energy. What does it do for our bodies? What is it providing us? And they've kind of learned too, like there are foods that just like don't make them feel great. But I think empowering kids just with that education is so more important because if you just vilify something, I'm telling you, when they leave their house, like your house at age 18 or whatever, they're like, bye, mom. Like, I'm going to Taco
yeah.
Bell. You told me I can't have it. Now I want it more. So I try to let them participate. I try to, like, they're getting to an age where they can help cook and prepare and things like that too. But they eat 3 meals a day. Yeah, and we try to not, like, do the snacking thing because I think kids a lot of times snack because they're never getting that good protein bolus, but the thing of it is, like, I may need 30 to 40 grams of protein, but kids probably, I think that Gabrielle Lyons told me, like, the studies would suggest they could probably do 15 grams of protein and still stimulate muscle protein synthesis. So it's, like, sad to think that they're not getting that amount, like, in a meal. So we have a rule that if you are still hungry after the meal, or if you want more carbs or whatever it is, you have to eat your protein first. So that's just like the rule for
Oh,
us.
I
You got
like
to
that.
eat that first, and if you want more, then we'll get more. But I think once they eat that, they get that satiety, feeling more often.
I love that because most snacks these days, most of them are primarily just carbohydrates.
Yeah.
Very, very, very little protein. I think it's about 12% protein in most snacks, and it's not enough, and it's just all highly processed, refined carbohydrates. So
Yeah.
that's awesome. I love that rule. I got to implement that. That's cool. Let's talk about pregnancy. I'm super fascinated with this. Obviously, someone very close to me is about to have their first child, and one of the things I'm interested in, I've seen this a lot, is you talked about it with the oral glucose tolerance test.
Yeah.
Um, and so something I was talking with him about was I was like, oh, is she going to do the oral glucose tolerance test? Or are you going to try and talk to your doctor and see if there's another option? Um, Currently, like, do you still think that that's the best method for determining someone's insulin sensitivity while they're pregnant, or if diagnosing them as probably having gestational diabetes, or are there other markers that people can also do?
So it's the most widely studied test. So our governing bodies still recommend it for people that have risk factors. And these days, you can pretty much find a risk factor in every patient.
Right.
Um, I've had a lot more patients recently ask about not doing it. And I think an alternative to not doing it is testing your blood sugars. So, traditionally, before I kind of changed the way I practice medicine, if patients ultimately refuse, then we just say, okay, well, then we're going to treat you like you have it and we're just going to have you test your blood sugars. And sometimes the blood sugars were completely normal. Um, but if they don't want to do that, if they don't want to poke their finger 4 times a day, which is what we ask them to do, then, taking the test is one thing. There have been alternatives to the test, like using real food or using jelly beans, or so it's kind of like what's the lesser of two evils? Because a lot of people don't want to do the test because they don't normally eat a 50-gram glucose challenge. And it usually makes them feel horrible. And then, of course, the lab provides us with these free glucola tests that typically have like red dyes and all these other ingredients in it. So there are some like quote unquote cleaner versions out there. Like there's one called Fresh Test, and but the patient has to order it and pay for it herself. But I'm a huge fan of just testing, putting a CGM on if they are willing to pay cash for it, getting them a glucose meter and just having them test against their meals. So we're looking for fasting blood sugars less than 95, and we're looking for 2-hour postprandial blood sugars less than 140. Um, the continuous glucose monitor is amazing. It gives them so much information about, what's happening. But I don't think all doctors are as open to this idea as I am. I've had people message me and they're like, my doctor says this is it. If I don't do this test, they're firing me. I got to find another doctor. Um, I also use a pretty strict cutoff for the 1-hour glucose test. So some clinicians will use 140, some will use 130. I use the lower test because I would rather find more people with insulin resistance. And we know it's a linear relationship. So there's people that are just barely passing that still have insulin resistance, or they may fail the 1-hour test and pass the 3-hour test. And still have risk of having a really large baby, a baby that gets admitted to the NICU for hypoglycemia. And what we know from the follow-up from the HAPO trial, which is the hyperglycemia adverse outcome trial, which is one of the best studies that's been published, I think, in the recent decade, shows that it's not just about gestational diabetes in the pregnancy. There is clearly a risk to women who get a diagnosis of gestational diabetes. Their long-term risk of obesity, type 2 diabetes, cardiovascular disease, metabolic disease, not only in the mom, but in the baby. So there is epigenetic fetal programming that is happening in a pregnancy where the fetus is, through these methylation pathways, kind of sensing the environment, the nutrition, the stress that the mom's under, all the things that she's doing. And it can actually switch on and off these genes in the baby. And so we know that moms with gestational diabetes, their offspring have a higher risk of insulin resistance over their lifetime. And so this is a big deal. It's a huge deal. We're seeing not only more gestational diabetes, but we're also seeing more high blood pressure in pregnancy these days and preeclampsia. And we can dive into that, which I didn't know going through my training is very much tied to insulin resistance and hyperinsulinemia.
I didn't know that either. And we were talking earlier about a recent case in which this came up. Could you share a little bit about that and kind of what your thoughts and perspective on that are?
Yeah. So, there's been some headlines this week. Tori Bowie, who was a US Olympic athlete, was found deceased in her home, pregnant. And I don't want to speculate a lot because all I know is what, the internet tells us. But the medical examiner did release her autopsy results and kind of estimated that she may have been 8 months pregnant and that she died. The headlines are saying died during childbirth, but it sounds like she may have had preeclampsia or eclampsia, which is a hypertensive, high blood pressure disorder that happens only in pregnancy. And it is in developed countries the most common cause of morbidity and mortality amongst pregnant women. Worldwide, it's hemorrhage, but in developed countries, we're very good at treating hemorrhage. And she was African American, which we know that these women are 3, 4, 5, 6, 7 times more likely to die in pregnancy. And it's likely due to a multitude of reasons: metabolic disease being higher in this population, socioeconomic status, um, you know, uh, bias and racism within the medical community. And so there's a multitude of reasons. And so I'm not going to speculate. There was a lot of things, though, that I had questions about just with the medical examiner. She's 5'9" and it said she weighed 96 pounds. I'm 5'9". I'm like between 160, 170. So we don't know. We can't just assume because she was a US Olympic athlete that she was, really healthy coming into the pregnancy. But let's just talk
Right.
about hypertensive disorders of pregnancy. So high blood pressure of pregnancy, it can be related to hyperinsulinemia and insulin resistance. So people that have obesity, diabetes, any sort of underlying metabolic disease coming into pregnancy, these patients are at higher risk for getting high blood pressure in pregnancy. And what happens on this spectrum is you get high blood pressure, then you get preeclampsia, then you can get something called eclampsia, which literally means seizures in pregnancy. It's a Greek word for lightning. They used to call it toxemia, but now we don't use that verbiage. But it's extremely dangerous. It's not something to be taken lightly. And this is why we regularly check blood pressures on pregnant women, especially in the third trimester. So it's generally something that happens in the third trimester, but you can see it develop in the second trimester. And then it's usually very serious and very scary. And there's other little offshoots like HELP syndrome and things like that that are all kind of in this spectrum of diseases. Now, here's how this all starts. So it's caused by the placenta. So when you get pregnant, this embryo has to burrow into the endometrium and it has to create a vascular connection between maternal and fetal circulation. And so these little syncytiotrophoblasts kind of dive in there and it creates these spiral arteries. Well, part of this, the nitric oxide pathways are extremely important in creating this interface. And so people who have dysbiosis in their gut, people that are mouth breathers instead of nasal breathers, people who have endothelial dysfunction because they have hyperinsulinemia, hyperglycemia, whatever it is, there's a lot of paths to this same problem. Um, there's something wrong with the placenta. So this uteroplacental insufficiency, basically the baby is not getting what it needs. And so the placenta is always team fetus. So it will take whatever it needs from the mom. So what it will do is it'll start to elevate the mom's blood pressure. So if we increase the mom's blood pressure, we push more pressure into these arterioles to try to get across them what we need. Also, pregnant moms who have insulin resistance and diabetes and things like that tend to be deficient in magnesium, which tends to relax the blood vessels. So that causes more vasoconstriction. And then what happens as this disorder goes on is it starts to affect endothelial dysfunction. And so they can get hypercoagulable, they can throw blood clots, they get leaky vessels. So they start getting really swollen and really puffy. It can start to affect their kidneys. They can go into liver failure. It can start to affect essentially every single organ system in the body. And the only treatment is delivery. So the only treatment is to get the baby out, get the placenta out, and then the mom starts to get better. But sometimes it's not immediate. They can get sick postpartum too. So it's not something to be taken lightly. And if a woman has had it in one pregnancy, she's at an increased risk of getting it again in a second pregnancy. There's likely some genetic immune system susceptibility to these types of things, but across the board, metabolic disease is a giant risk factor for hypertensive disorders of pregnancy, including preeclampsia and eclampsia. And, when we throw around stats like 88%, 93% of the country has metabolic disease, and you're talking about people who are in years of reproduction, that's a real problem. That's a real problem. And we have a maternal mortality issue in the US. I mean, we're like a developed country. We should be really good at not letting pregnant women die. And it's for a multitude of reasons. Our health system isn't perfect, but people are just not as healthy anymore. So for anybody listening, I think it's so important to get your health in a good place before you get pregnant, because in pregnancy, this is the greatest physiologic test of your life, essentially. And for me, it revealed my insulin resistance. It revealed a lot of weaknesses, in me. And unfortunately, it's your health and your baby's health that are on the line. So it's a real big deal.
That's incredible. Thank you for sharing that. I mean, for someone who is of childbearing age, interested in having children, even if they're not interested in having children, we know that metabolic health is very, very important just for overall health and longevity. But someone who's of childbearing age, potentially exploring the idea of having children, and say they're not metabolically healthy, what type of time frame would you say, hey, you know what, bunker down for the next 6 months and do these things to try and get your metabolic health in order, and then maybe start trying What would be your recommendations on that?
I mean, in my experience, I think that patients that are really motivated, they're ready to do this, you can massively change your metabolic health in a year or less. Did it take you 5, 10 years to get here? Yes. But I mean, I've seen de escalation of diabetic meds, hypertensive meds within weeks, on a low carbon ketogenic diet. Um, if you have a lot of weight to lose, unfortunately, you can't put a timeline on that. Slow and sustainable. Slow is the fastest way to get there. But I think from a metabolic perspective, thinking a year out from when you want to conceive, you could do a lot of really good things. You can get your diet in a good place. You can increase the nutrients in your diet. You can start exercising because exercise, I mean, labor, like delivering a baby, talk about like a sprint and endurance sport all in one. Like it's crazy. If you've ever seen like a woman like just give birth naturally, like it's really incredible. I'm in awe of it every single time, and I deliver, I've delivered thousands of babies in my lifetime. But getting good sleep, getting to the dentist, getting your teeth cleaned, and making sure you don't have any oral issues going on. Because I had a guy on my podcast recently. We were talking about the oral microbiome, and the bacteria in your mouth are related to these nitric oxide pathways. And we know that people who have dysbiosis in their mouth have more preeclampsia, more high blood pressure, more gestational diabetes. So go to the dentist, get your teeth cleaned, make sure you don't have any teeth that need fixed or repaired or cleaned up or whatever it is. Your husband should be doing this too. This is not just for the ladies. We know that uh, male paternal health affects sperm quality and affects epigenetic modifications in the baby too. So you got to do this together. You're going to be bringing home this new human. Let's get healthier. Let's get in a good place. And hey, the first couple months, you can tell, you can tell Jacob I said this. The first couple months are a fog. I mean, it is like, you want to be healthy. Okay. You want to take care of yourself because the first 4 months is like survival mode. Human babies are really worthless. Like you have to do everything
Yep.
for them. Thank God they're cute, right? So,
Yep.
yeah,
Yep.
yeah. So you want to come into it, in a good place.
It's fascinating because I'm watching him go through this experience right now, and like he is in the best shape of his life. Like everyone's like, dude, you've lost a ton of weight. And he's like, I'm prep, like he's treating it as like this preparation. As this baby's gonna come out and everything's gonna change in his life. He's not gonna get as much sleep. Obviously, probably his diet's gonna be a little bit harder to stay on point, but like he's using this as an opportunity to like really dial everything in. He has been for the last year or so as they've been planning this. So it's been amazing watching kind of that transformation. Um, Women who are pregnant, so say, cool, you get pregnant. Um, are there any recommendations you have for them? Obviously, like supplement and stuff like that, like taking a prenatal even before they're getting pregnant, but obviously while they're on while they are pregnant, but also things like, hey, first trimester, second trimester, these are types of foods that you want to incorporate in, or things that you want to encourage. Maybe do a little bit more of this type of training, or try and just walk at this point. Any recommendations as someone kind of goes throughout that journey?
Well, the first trimester is a little rough for a lot of people. So the HCG hormone, we see about a 30% increase in insulin production from the pancreas as soon as you get pregnant. So we've got some blood sugar dysregulation. They're feeling nauseous. The first trimester can be just like survival mode, but prenatal vitamins are like an insurance policy. So the more you can get that from food, the better. Like those nutrients are just more bioavailable. So, but the first trimester can be hard. So if you can stomach a prenatal, it's like an insurance policy. When we think about the nutrients that are required to grow a human baby, a lot of them come from animal foods. So folic acid is the one that gets all the press, but folate is really important for neurologic development, creating this little neural tube, the baby's brain, the nervous system, which is one of the first things to develop in the baby. You don't want to be deficient in that early in pregnancy. And sometimes people don't know they're pregnant for, several weeks. And so these foods are, meat, liver, eggs, dairy. You can get them from plant foods. You just have to eat a massive amount more to get them,
Right.
and there can be other things that can make those less absorbed. So, but just a whole food diet, just cutting the processed crap out of your diet. Getting through that first trimester, you'll start to feel better once you're in the second trimester. There's, it's like the perfect time in pregnancy. You're not huge, you're feeling better. But exercise is safe in pregnancy, and if you didn't exercise prior to becoming pregnant, you can exercise. Start exercise during pregnancy. It's very safe. We usually tell people like 80% max heart rate. You want to be able to talk. It's not the time to like try to PR. But maintaining your physical activity in pregnancy is important because that improves outcomes in labor and delivery, it reduces your risk of excessive weight gain, reduces your risk of high blood pressure and gestational diabetes. So, walking after meals is great. That helps with blood sugar regulation. The insulin resistance of pregnancy doesn't really develop until the second half, so like the third trimester. So that's really the time that you got to buckle down. You can't be like eating the Easter candy or the Christmas treats and things like that. That's when you really have to be, more careful. But the first half of pregnancy is very anabolic, and then the second half of pregnancy is very catabolic. So the body is breaking down. It's just there's free fatty acids, there's ketones, there's glucose, everything that's available to this baby. I'm telling you, but once you've been through a pregnancy, like I said, the placenta is team fetus. Like it will leach the calcium out of your bones. If you're not getting enough, it will take everything from you that it needs to grow that baby. Um, and then as you get to the end, right, you're excited, you're anxious, and you're ready to deliver. And then you have to think about postpartum, which everybody thinks it's like rainbows and butterflies, but like kind of I alluded to, you can help these postpartum people out in your life by maybe like prepping some meals from them. Because when you're just trying to feed the baby, change the diaper, you're not getting sleep. What they do, they stop brushing their teeth, they stop eating. Need everyone wants to come over and hold the baby. Like, let the mom and dad bond with their baby. How you can be helpful is get her some nutrition, let her take a 1 hour nap, let her go shower, let her brush her teeth. Those types of things can be the most helpful. And I tell my patients, like, set the boundaries with your family now.
That's great advice. That is such great advice. Now, is there any concerns? Because I think organ meat and liver and things like that can be super beneficial. Like you said, a lot more bioavailable in terms of vitamins. Is there any concerns of overdoing that?
Yeah, we haven't seen overdose of vitamin A from real diets. Most of that is from taking supplementation, taking synthetic vitamin A supplements. But I think, 1 to 2 ounces a few times per week is really appropriate.
And then I have to ask this question because I've seen it a lot more recently. My cousin went through some things like this. Fortunately, she's got a super healthy 2-year old at this point. But what about bleeding during pregnancy? Like I've seen people who are in their second trimester and like having extreme bleeding and nervous, and then they go to the doctor and doctor's like, "Baby's okay." What typically is driving that?
Yeah, well, of course, bleeding in pregnancy is terrifying because any woman thinks that she's losing the pregnancy. So it's pretty common though. So, when this embryo has to implant, it has to create this maternal fetal interface that I talked about. These are, blood vessels connecting to blood vessels, right? They're not actually connected. There's a little membrane that the nutrients and the oxygen flow across. But 30% of pregnancies can have bleeding in the first trimester. The most common reason is something called a subchorionic hematoma, which is like a small bleed that develops kind of like behind where the placenta is developing. And it's where these blood vessels are kind of connecting. Majority of the time, it's terrifying, but nothing happens. Majority of the time, the body will resorb the blood clot. The pregnancy progresses and grows like it's supposed to. Sometimes when they get large, it does increase the risk of miscarriage and pregnancy loss. Because as the blood clot expands, it can basically create a shear force where it will shear off the placental connection. In the second trimester, we tend to see less things like that. Sometimes you can just get bleeding from the cervix. So patients that have intercourse or exercising, sometimes you can get a little vessel that can just bleed within the cervix. And you have to remember that the blood volume is expanding in pregnancy. You have more red blood cells, and you have about 30% of your cardiac output going to these uterine arteries to the uterus. You have a ton of blood flow going to the pelvis, and so um, these blood vessels, like the cervix, like I said, sometimes there's just like a little vessel that bleeds and it's nothing. But any bleeding has to be evaluated by your doctor because you want to make sure you're not in preterm labor, that the cervix isn't shortening, that you do have some sort of, detachment, placental abruption happening. So you always want bleeding to be evaluated. And it is always very scary. Sometimes it's nothing and sometimes it's extremely serious.
Right.
Same thing in the third trimester. As you get to the very, very end, as the cervix, what we call effaces or shortens, starts the collagen starts to get broken down by these enzymes. Sometimes you can have a little spotting and it's very, very normal. And then as women give birth, we see what we call bloody show. I mean, there's blood, like it's there's blood, which is really terrifying to a lot of people, but to me, it's like very normal. But you always want to get it evaluated. But the reason it's happening is because I mean there is this delicate interface between intrauterine and extrauterine life, and you know it's not perfect, but high blood pressure of pregnancy, gestational diabetes, all these things we talked about increase your risk of complications. So you just want to control the controllables, be as healthy as you can, and have a good healthcare provider that you trust. That's gonna. I tell my patients, you worry about what you get to, and let me worry about the big scary things. That's why I'm here. That's why you hired me.
It's a beautiful process, but sometimes can be scary, but overall it's beautiful. I think one of the things I'm interested in, have you seen a lot more patients asking for the placenta? Like, have you seen more people kind of storing that or asking ways to freeze it, or is that not a thing yet?
Yeah. So placental encapsulation. So in mammals, there's a lot of mammals that eat their placenta. When you look at like the origins of why they might do that, a lot of it is to protect their young from predators. So, people think they do it for the nutrients and maybe a little bit, but a lot of it is just to protect their young from predators. And I tell my patients like T-Rex is not coming to eat your baby in the hospital. Um, I think a lot of people think it may help with postpartum depression. There's not any clear evidence for that. And there is some evidence for harm. We've seen case reports of people that don't prepare the placenta and desiccate it well, and you can get E. coli or Group B strep. There's been babies and moms that have gotten very sick and or died from a poorly prepared placenta. Um, but there's some people in my community that do it, and I really trust them in their process. So the patients that want, I'm like, okay, these are the people you should use. There's a cost associated with it. Now, whether it's placebo effect, I mean, we have very good placebo trials where a patient's literally told there's nothing in this, but it's going to make you feel better. 50% of
Yep.
them get better. So, there could be a very strong placebo effect. We just don't have any scientific evidence to say physiologically that it really provides, a benefit. And there certainly is risk. So, but I've had patients, I had a dad one time who used it as fish bait. I've had
Oh
a
my
guy who took it
gosh.
home and planted a tree with it, which I think that's kind of cool. Like he threw it in the
It's
hole
neat.
and put the tree in there. And so
Gotcha.
I've seen people make really cool art with it or jewelry or things like that. So it's a really interesting organ, that's for sure. It's like the only organ that's
It's
like disposable.
it's interesting. So I think Jacob and I have been talking about it, and ideally, I would like to find a way. I think he may do this. Is find a way to freeze it, ultimately for the stem cells,
Oh, yeah.
and give them to them in 10, 20, 30 years from now,
Yeah.
allow them to inject their own stem cells back into them. I
Yeah,
don't
so
know.
you can do cord blood banking, but there's no public banks, they're all private, so you pay for that, and, statistically speaking, most people won't need those, like, unless one of your children get leukemia and this baby is like an exact donor, right? To do something like that. But yes, Tony Robbins, I think, has made this, publicized this. A lot of other countries are using cord blood and placental stem cells. And that's because they are, eh, I'm trying to say this in the most plain language possible. Basically, they're pluripotent, meaning they can turn into any kind of cell. So, like a stem cell can become a heart cell, a kidney cell, a brain cell, whatever it is, versus like whole organ transplants. You have an immune system involved. You're more likely to reject those things. So, we're seeing a lot more treatment with stem cells that come from placentas and from cord blood, and it is a like disposed organ, right? Like we're just
How
dumping it in a bucket. So like how could we like collect all of these and like help more people? But certainly, there's a lot of cost involved and things like that. And I love where Tony and his team and kind of have their head thinking about this. How could we do this on a large scale where it's not just available to people with a lot of money? But that's an interesting thing that Jacob is considering because it's like it is the future of medicine, I think.
It's fascinating. I've gotten some of those in Colombia. I did a whole treatment in
Yeah.
Colombia at one of the clinics, and it's It's interesting. I just did it more for the longevity piece, but I went with people who went and got it in their knees, in their chest. Some people got it in their hair. You name it. You could put it in almost any body part. And some people saw drastic improvement, especially in like knees and shoulders. So yeah, I do think it's a big part of kind of the future of medicine. Like you said, a lot of it right now is being disposed of. It's like, how do you harness that? It's obviously very powerful, and then use it for good. Right.
Yeah, I've had patients, go to other countries. I've heard incredible stories. I've had some doctors in the US. There's a lot more regulation here, so it's very
Yeah.
difficult, to find products and things like that, and so, but I've experimented with exosomes and peptides and different I just think
Yeah.
there's, like, gonna be some amazing things that are available to us in the next, 5, 10, 20 years, and, it's definitely the future of medicine.
I love it. One of the last topics I want to talk about is optimizing metabolic health. So I know recently you've talked about this, and could you just give everyone a general idea of like what labs should someone do if they want to look at like, am I metabolically healthy?
Yeah. So I think on a really basic level, you could check a lot of things. And I'm like, I'm a doctor, I'm a nerd. So I would like check thousands of dollars of labs. I think on a really basic level, you go to your annual exam, come 12 hours fasted and check a CBC, which you don't have to be fasted for that, but a complete blood count. So that's going to look at your hemoglobin, your platelets. It's going to give you an idea of like, if you have anemia or some immune problem, because it also has your white blood cells on there. You're going to check a CMP, a comprehensive metabolic panel. So this is going to have your liver and kidney function. It's going to have your electrolytes on it, and that is going to have a glucose on it. So you're going to be fasted, and you're going to see what your glucose is, your fasted glucose level. I like to check an insulin and an A1C. So fasted insulin level, just screen for hyperinsulinemia. I have seen fasted insulin levels of 50, 70, like real high. Um,
Wow.
Hemoglobin A1C is like a 3-month average of your blood sugars. So it's kind of nice because a fasted glucose can be affected by a lot of things. Like, let's say you just went to the gym and then you came into my office to get your blood drawn and you just had this workout, or the cortisol effect of waking up 30 to 60 minutes. Cortisol will naturally make your blood sugar rise. So, like a one time fasted glucose, like I don't get like super excited about that unless it's like really high, right? Like over 120, that's diabetes.
Yeah.
But so I like the A1C just because it kind of gives me another piece to the puzzle. And then a basic lipid panel. So this is, and most people are going to think I'm looking at the cholesterol and the LDL, which I am, but I'm also looking at the triglyceride to HDL ratio because this tells us a lot about metabolic health and insulin resistance. So I think on like a real basic labs, that is what I would check in like everybody, and then start thinking of other things you might look at. So, I sometimes am looking at hormone levels. I'm sometimes looking at iron panels or thyroid function. Sometimes I do a more advanced lipid panel. So in patients with higher risk of cardiovascular disease, we're checking panels that have like LP little a, ApoA and ApoB, a high sensitivity CRP, um, PLA2 activity. These are all kind of like markers for cardiovascular risk. Um, and they're just more expensive. So that's why I'm just saying, maybe some people a basic lipid panel might be okay, especially if it looks good and you don't have any risk factors. Um, and there's all sorts of other things. I mean, I check a lot of vitamin D levels. Insurance hates to pay for it. So sometimes patients have to pay cash for that. But I check a lot of vitamin D levels because that's very much tied to our metabolic health. Sometimes other nutrient levels. But I think that's kind of like a good basic starting zone is just checking a CABC, CMP, A1C, insulin, and lipid panel. Like that would be a great starting point.
And then outside of the blood, like I know you and your husband opened up a facility where you guys kind of do, you also have like a gym portion of things, but you also have some testing that you can do as well. Do you incorporate in any of that? So any like body composition stuff as well?
Yeah, so we have a DEXA machine. Patients have to pay for it, so we don't bill insurance for that. But I think that it gives you so much more information than stepping on the scale. I actually read an article they're trying to get rid of BMI. Like finally the medical societies are looking more at like how do we measure visceral fat? So the reason I love it is because it looks at visceral fat, it looks at how much muscle you have, and it looks how much subcutaneous fat you have too. Because these are just more objective ways that we can say, are you healthy? Because there are some people that might have 30% body fat as a woman, and I check their labs and they're very metabolically healthy. They may not like the way they look at 30% body fat, and they can still change that and be healthy. But, for me, it's just how do you feel? How are you functioning? Metabolically speaking, are you healthy? You might be too low body fat. You might be normal subcutaneous fat and not have enough muscle and have a ton of visceral fat. I find that in a lot of patients. Visceral fat is the fat that's like deep down around our organs and is like a major risk factor for all cause mortality, like dying for any reason. And it's related to metabolic disease and bad diet. And it's related to alcohol use. Those are like the two big ones. But for a lot of these people, like I said earlier in the podcast, for women, like a lot of times it's just that they're not focusing on building lean body mass. It takes dedicated effort, regular training, adequate protein. It's just something that takes a lot of time. And we're so addicted to quick fixes, like go on a diet for 30 or 60 days and just get ready for the summer. And then we just go back to all our bad habits. So I love using the DEXA as like a snapshot in time from year to year that we can show people that they're improving. So we've been open 2 years now, this coming August. And we have a client who she's postmenopausal. We'll do a highlight on her for you guys. We need to share her story, but she's postmenopausal. She was dealing with some insulin resistance, couldn't tolerate hormone therapy. So she came in and she's been doing our exercise equipment, which is called eGym. And then we've been tracking her results with the DEXA, and she's been kind of cleaning up she's eating a low carb diet. Her assessed like bio age on our machines when she first came in was like 77. And she was in her 60s when she first came in. My husband came home last night and he was like, "Hey, that client," he goes, "guess what her bio age is now?" I was like, and he says like 37 or something like that.
Oh my god.
And this is in 2 years. Like, this woman has put on
Yes.
muscle, she's gained incredible strength, like, she's not gonna fall. She's eating, she feels amazing. She's in, like, she said, like, the smallest clothes she's been in her adult life. Like, it's incredible, and it's just 2 years of just being consistent, just, like, eating better. She comes in, she puts in the workouts, and that's it. It's literally like, there's no magic. Consistency is the magic.
It is. Consistency is key. You're doing a couple different things to also help optimize your metabolic health. I've been seeing recently. One, I think right now you're doing a year without alcohol, right?
Yes.
I see that. Can you talk a little bit about that? And I've seen you post a lot about red light therapy. For people
Yeah.
who don't know any benefits of that.
So, like, I started drinking in college, and my husband and I just did it really socially. And I kind of had thought for a while, like, man, I'm just like, I'm telling people to be healthy. And then like I do this thing. And I do think that, you can find moderation. I don't think it was like harming my health in any way. Metabolically, I was really healthy, but I kept thinking like, maybe I'll give it up for 30 days or 60 days or 90 days. But then it was always, oh, but then it's lake season, then it's football season, then it's Christmas. Oh, then it's my birthday, then it's this event, that event. And I would always find these like dumb reasons why I wouldn't do it. So finally I had a friend who challenged me. He's like, I bet you can't go 365 days. And I'm like, okay, well, that makes sense. Let's do 365 days, because then you have to go through every time of the year. And it will give me a sense of like where my weaknesses are. And like maybe I find that it doesn't really add to my life. Like maybe I find that I can go to social events and not drink and have just as much fun. So October 1st of last year, my husband and I gave up alcohol for 365 days. I feel amazing. I don't know. Maybe I'll have a glass of wine here or there. I don't know. I haven't made that decision yet. But um what has been mind blowing is every time I share on social media about it, the keyboard warriors like come out on both sides. Like, oh my God, I'm so proud of you. I've been sober for 11 years. I'm a former alcoholic. All the way to this guy the other day was like, you're a doctor. I think you understand that moderate drinking doesn't impact your health. Like all the extremes. Like people will go to the ends of earth to defend like their choices. I'm just sharing my journey. Like I'm just being
Right.
transparent. Anyway, so we gave up alcohol and we don't really miss it. That's just like the honest truth. And when you stay away from it, you realize like how pervasive it is. Like it's everywhere, like every night of the week, all the things. And then red light therapy, when I first saw it, I thought it was total voodoo. But I think I bought my first light in 2018. I've owned like 3 different lights now. And I got on PubMed, literally typed in red light therapy. And I'm like, oh my God, there's tons of studies. Like there's data for thyroid and skin and ortho and eyes and all these things. I'm like, what? but nobody had really made like a unit until Juve kind of came around. Like nobody had really made a unit that you could do at home. And so you had to like do it in your derm's office or wherever. But so we've had a unit and it's like my Zen time. Like I spend my 20 minutes. Maybe I'll meditate, maybe I'll check emails, whatever it is. But I do like 20 minutes and I try to do it a few days a week. Um, and it's like when you first start, you're like, I don't know, is it doing anything? But once again, it's just consistency. Like I use it a lot. I'm also trying to get sunlight because red light is only a specific wavelength. So you still want to get sunlight,
Correct.
especially for circadian rhythm, morning and afternoon and evening. But red light, even blue light is used for things like acne. So everyone, they think it's a bad thing, but blue light is good in its appropriate doses. We need light, like we're receptors of light. Like we are like plants in that we get energy from the sun. And so I used red light for a lot of things. I of course, used to have a thyroid issue, so I love exposing that. I like it just for anti-aging. I always tell people, "You guys, it's fit and fabulous, not fit and frumpy." So I gotta keep the skin looking good. But my husband, of course, like read the Ben Greenfield article that you could put your testicles in front of it and increase your testosterone. So we, of course, had to do an N of one experiment with that, and it did indeed increase his testosterone like 250 points. So we use red light. We
That is
love it for a
fantastic.
variety of reasons. Yeah. And there's no risk or harm. So it's a great thing.
No, and what's your protocol now? Like throughout the week, how many days and how long again?
Yeah. So, I usually have time to do it maybe 4 or 5 days a week and I do it for 20 minutes. I sit about 12 inches from my light. So,
Perfect.
yeah.
And then I have to ask this question. My wife was like, "You have to ask her this." I've been seeing her post all about it. Um, you recently went through a hair loss journey, and now you're kind of battling it, and you've done some amazing things. What was that like? I think she actually had something similar with COVID and then going through a miscarriage.
Yeah.
So that kind of was a brutal thing. And then you start to lose hair on top of that.
Yeah.
It's like, damn, what do you
This
do?
was like a triple whammy. So I did my bodybuilding competition in April. So I'm like in a deep calorie deficit, which already can cause telogen effluvium and hair loss. But literally right after the competition, I got sick, which I can only assume it was COVID. And my hair started shedding for like months. Then I started to see some regrowth. I'm like, I know it'll come back. It's just telogen effluvium. And then I went down to Santiago, Chile, and I came back and I really wasn't that sick, but I kind of had a headache and I took a test and it was positive for COVID. And then the next day I felt totally fine. But then 5 days later, we ordered some takeout food. And that night I got severely ill, like 105.6-degree fever, diarrhea, and was eventually went and crapped in a bucket to find out I had salmonella poisoning. Took antibiotics for that, but then like the shedding just like it started again. And I'm like, oh my God, I don't have more to lose. Like it was so distressing as a woman. And so now I've just been on this journey of like, how do you grow your hair back? You have to be patient because it only grows 6 inches a year. Thankfully, it is coming back. I just did a story this morning. I have these like 6 to 9 inch hairs on my head. I'm doing PRP injections in my scalp. I'm doing red light. I'm doing a dedicated hair vitamin. I'm eating my protein and collagen and things too. I changed my hair care products. I found that I don't like the serums. I don't only wash my hair twice a week, so I don't want to put stuff on my scalp. Like I don't know how you can get it on the scalp and not get it on the hair. So those products just
Right.
annoy me. But I would say like if you look at the literature, get adequate nutrients and calories, like don't be in a calorie deficit. Um, think about PRP and stem cells. It's expensive, but it's something to think about if it's super distressing to you. And red light of the scalp is really good. So those would be like I did a YouTube on it. It's like those are kind of like the top ones that I would consider. You're going to see lots of gimmicks out there. Don't waste your time. Like you just have to be patient, honestly, and see a
Okay.
dermatologist if you can't figure it out because it might not be telogen effluvium. It could be thyroid dysfunction. It could be iron issues. There's other reasons, androgenic alopecia, too high of testosterone, too low. So there's lots of other reasons. So see a doctor about it. But if it's telogen effluvium, it will come back. You just have to be patient.
Great advice.
Yeah.
Last two questions and then we'll wrap into our final four is
I actually have to go deliver baby here in like 10 minutes.
perfect. Perfect.
The hospital's texting
That's
me.
that's
I'm like, "I'll be
amazing.
there, hold on."
What does it mean to be hard to kill? I know that's a slogan for you.
Yeah, hard to kill is basically like the rule that I live by. So, my 5 pillars are nutrition, exercise, sleep, stress resiliency, and environment. And I try to mold my life around those 5 pillars because it sounds cheesy, like hard to kill, but for me, it's that like we're not immortal. Like I could die tomorrow. So for me, it's just living your life in a way that is so appreciative and grateful, like showing gratitude that I woke up today and I'm breathing. But at the same time, like I don't want to be taken off this earth by something that I could have prevented. Like, I want to maximize my time. So, like, hard to kill for me is like my internal language of how I live my life, and how I feel like I can live the best life possible and leave the greatest legacy for my 3 daughters.
It's amazing. And you're definitely doing that. I see it every day. So huge kudos to you. Quick four. One answer, like, what's your favorite meal?
Bacon and eggs.
Oh, good. I like that. Favorite book of all time or book you're currently reading?
Ooh, the most recent book I read was Dr. Chris Palmer's Brain Energy.
It's a great
Huge fan
book.
of it. Huge fan of him.
Um, what do you 100%? What are you most excited about in your life right now?
My girls, they're turning 8, 10, and 12, and they're at a time in their life where they're busy, they're playing softball, they're in activities, like, I'm just watching them, like, become big kids and adults, and it's literally, like, one of the greatest joys of my life.
Love that. And then what's one thing people can do today to improve their health?
I would say the low-hanging fruit is nutrition, like, it's something we do multiple times per day, every single day, like, we have to eat to stay alive, and so if you wanna change your health the quickest, I would start cleaning up your diet.
This has been so incredible. Where can people find you? How can we support you? Everything that anywhere we can find you.
Okay, well, you can find me. I'm most active on Instagram, Dr. Fit and Fabulous. I've got a website, drfitandfabulous.com. I wrote a book called Hard to Kill. You guys can see it back there.
Love it.
But yeah,
Great.
come find me, come follow me. I'm literally just a human sharing my life with the world.
You're amazing. Thank you so much, Dr. Jamie. Go deliver that baby. We appreciate you so much, and we'll talk to you soon.
Thanks, Ryan.